Hello and welcome. We'll get started in just a minute. Good morning and good afternoon for those of you who are in a time zone other than mine. My name is Marie Boone Clark, and I'm founder and executive director of Birthing the Magic Collaborative. So excited that you guys have joined us this beautiful day for most places. And if you're dealing with not so beautiful weather, I'm sorry. I am going to ask you to drop in the chat if you are expecting or what brought you here today. So Simone has some idea of who she's talking to. And then we'd love to know where you're joining us from. And I'll kick us off. If you've not met Simone, we've been so blessed to have her do a couple of workshops for us. But if you've not met her, let me do a quick introduction. And then we'll start chatting about our important topic. So I'm pleased to introduce Simone Toomer, who is an experienced professional with over a decade of experience creating a supportive environment for expectant and postpartum families. Not only is Simone a doula, she's also an international board certified lactation consultant, so she can help you with your breastfeeding needs. And in addition, she's a childbirth and infant sleep educator. I suspect, however, her most rewarding role is that of being a mom. Welcome, Simone. I'm excited to talk about this subject because as someone who tends to get a little anxious about everything, I've recently begun trying to practice mindfulness techniques. So I'm looking forward to talking about how this methodology can be transferred to the birth process. I also acknowledge I probably have not done your amazing, amazing body of work justice. So jump in, share with us additional things that you're doing. I know you have a doula training and a number of other things. So I'll yield the floor to you, my friend. You're muted.
Good afternoon, good morning. It's just turned afternoon for me. And it is not so bright and sunny here. It's quite rainy. It's been rainy for the past like 2 weeks off and on. So hopefully if there's no sun out, sun is coming from your loved ones and your friends and your family. I am Simone Toomer. I'm from New York. I'm currently in the Charlotte area doing birth work and lactation support for families. Definitely a different climate. It's interesting to navigate how each state is so different. So I want to highlight that a little bit today in regards to, as we talk about mindfulness, and yes, we could talk about yoga and all the different things, but also mindfulness and what you choose for your birth and how to be empowered in that. So I would love to share a PowerPoint with you guys today. Hopefully we have enough time, but also in talking about mindfulness in birth, we can't negate the prenatal period in our decision making, as well as the postpartum period in regards to our support in the community that we have around us as we transition into being parents. Marie, I'm okay to share my screen?
You should.
Okay, everyone. So before we get into like the nitty gritty, I do teach childbirth ed, but I assume a lot of you are, expecting or near your due date. I want you guys to just, place your hands on your chest and your belly and just take a few deep breaths in and out, right? You might feel some flutters on your fingers and on your hands as your little one kicks, right? Um, and just like open ourselves up for the information we're going to have today. I'm going to talk about mindfulness, but I'm going to drop some gems into regards to education because I really truly think that mindfulness of our pregnancy starts when we even, hey, I just found out I'm pregnant, right? Where do I birth? Who do I want to support my birth? I think a lot of times we don't have those questions really early. So I want to empower you guys to really think about the birth choices that you want, how you want your labor to unfold, how do you want your birth plan to look, and think about the provider that you have, where you're giving birth, and certain practices that we can implement through that. So I wanted to highlight here in the US, ironically, compared to a lot of the other places in the world, Canada, Europe, we are driven by our births are driven by OBs and GYNs, right? They are known for surgery, right? And a lot of times when people are looking for more holistic care and mindfulness in their birth, they sometimes often go to midwifery care. And I think it's important that if you are exploring that option, whether it is home, hospital, and birthing center, midwife, or OB, to really have conversations in regards to, hey, what is your approach in letting me go as long as possible? What is your thoughts on I am over 35? Will you want to induce me? A lot of times I ask that clients and families ask these hard questions really early on. So last minute when you're near your due date, you aren't thinking, oh my gosh, what if my provider isn't going to be at my birth? What if they have a vacation and their colleague is going to be with us? So definitely consider about how your state navigates birth and you choosing a hospital or a home birth or a birthing center. There are nurse midwives that practice in hospitals as well as outside of hospitals. And there's also professional midwives that are common, I find, in like California and Texas. It's for me, it was illegal in New York for a professional midwife to practice. It's also illegal here in North Carolina where I am now. So also thinking about all the options you have, and there's a saying, you don't know what you don't know, right? So I really empower you guys to find a local childbirth education class to really, really like flesh out your choices around birth. So in most states, 50% of the state's nurse practitioners, nurse midwives are able to practice in hospitals or at home, like I mentioned. In only 31 states, professional midwives are able to practice. And the beauty of midwifery care is that we do see the reduction of episiotomy. We see the reduction of the first cesarean, the primary cesarean, and we see an increase in rates of breastfeeding. And so as you think about all of this, I think mindfulness really transpires throughout the whole pregnancy through postpartum period. This is just a little visual of your baby's journey throughout, in your belly from now until labor starts. But I wanted to also get into some intuition and communication that we could start to develop with our baby through the pregnancy process. So when we think about mindfulness, I think in pregnancy specifically, we want to think of like fear reduction, right? It's so common that, and this is also in the postpartum period. My sister told me their birth story, and it there was some things that they didn't like, right? Or my aunt said that she couldn't breastfeed her baby, and really starting to ask those hard questions to our loved ones and to our friends in regards to like, what were those choices that could have been done differently? Or, if someone said I couldn't make enough milk, did you have the support that you needed? If you had a C-section and you're not high risk, we'll touch on that a little bit later as well. Do you think you had a doctor that supported your body to do what it needed to do in the amount of time that it needed, right? Your baby's your baby. Your body's your body. We are not on a clock. Some people birth in 3 hours, some people birth in 20 hours, right? I think it's really important to know that in this walk through pregnancy and postpartum, we need different things. We need to honor our autonomy. We need to honor the fear that might come up and where's that coming from, and the process of feeling those kicks and those hits, right? That kind of sometimes is like, oh my gosh, we have a baby in there. This is really real. And really diving deep so that when we go into that birthing space, we have that support system that holds space for us, but that we're also able to have that fear not necessarily show up in every aspect of it. I want to talk about meditation. We know how meditation reduces stress for many people, and meditation could be in different senses of yoga, journaling, prayer, just a daily routine that allows you to connect with your mindfulness, with your body, and with your baby. So definitely encouraging that, and that is something that also can continue into the postpartum period. Talking to your baby, right? Some of you guys may know the sex of your baby already. You might have some names. It might even be a surprise. And I think the same way love language is affirmation is a love language for some of us. Talking to your baby and affirming your baby and their existence in this world is so beautiful to connect with your baby as well as through the birthing process. Hey, I know we are doing a hard job. You might be climbing those steps trying to get labor going. You might be doing all the things to, cope and to be in the shower and to manage those contractions, those surges, right? But also talking to your baby, oh my gosh, you're doing such a great job in there. I got you. We only got a few more hours. I think really talking to your baby, talking to your partner, making your partner a part of your support team. If you have a doula, that collaborative team effort is really important. Everybody being on the same page with communication. Journaling, I brought that into mindfulness and meditation, but also it also gives a beautiful history of what is transpiring through your pregnancy journey that you could look back on and even maybe share one day with your little one. Hypnosis. I do find that there is a beauty in kind of mind over matter. If sometimes we get into hard spaces, doubt may come up during our birth where we don't know if we can push any further. We might be debating different options that are offered to us. And I think it's really important that to have like a mantra or an affirmation that you go over that could help keep you in this safe space mentally. Because when things are busy all around us, right, the reality is in the hospital, there's light, there's bright lights, there's noise, there's monitors, there's beeping sounds, there's many voices of doctors and nurses all over the place. Sometimes what we find is that the mantras and the things that we tell ourselves really can help to just keep us in a zone, keep us focused, and really quiet out the noise around us that could often distract us from where we need to be. Communication. If you haven't yet communicated to your doctor or your midwife about your birth plan, I definitely encourage you to look at birth plan templates, to think about what you want your birth to look like at home while you're laboring, before your water breaks. Not everyone's water breaks right at the beginning of labor. Some people's water breaks at the end, closer to pushing stage. How long do you want to be home for? What comfort techniques do you want to tap into? And we could dive into that a little bit more as well. You might be someone that always deals with upper body tension or something. So, a nice shoulder massage will help to keep you relaxed, right? So you communicate that to your partner. Maybe you communicate that to your doula. Just thinking also about the birth. Once you are in that birthing center, in that hospital at home, do you want to stay hydrated? Do you want your labor aid, your coconut water, your favorite playlist? These are things that as a doula, I encourage my families to think about in regards to really setting that tone in their environment, right? We know how safe we feel in our home and how sometimes when outside of our home, once in the hospital, we might feel our hormones shut off and we might be like, okay, what's going on here? So just bringing some little things with you from home to the hospital can really help with keeping that same energy for you, and you having these conversations, asking your doctor, hey, can I bring this with me? I want to have a playlist. How do you feel about that? Don't call my contractions, call them waves. I don't want to be examined every 2 to 3 hours. I really am an advocate of knowing your choices in birth. It's really important to use the acronym BRAIN, BRAIN, with anything that is presented to you, right? So B, benefits, R, risks, A, alternatives. I, intuition. What is your intuition telling you? N, nothing or needing more time, right? And so in the world of birth, if it is not a true emergency, you have time to think about things. You have time to ask questions, right? And in that asking questions and getting answers, you often feel more empowered. We know that unfortunately, birth doesn't always go the way we want. But what we find in research is that as long as people are participatory in their birth, making decisions, they feel more accomplished and more involved in their birth and happier with the outcome, whether it might be a C-section, a vaginal birth, some birth interventions that they did not want. The point is to always feel involved in your birth decisions. And then so I want you to tap into those different things that you know for sure you already enjoy in regards to mindfulness, feeling your baby, talking to your provider, and just really continuing that practice through the postpartum period. Marie, are you able to see any questions coming up that I may need to like slow down and ask, or you want me to continue?
We did not, let me turn my camera back on. I didn't want to be a distraction as I was taking frantic notes. We didn't invite questions, but we do invite
Oh,
questions.
no worries.
Um,
I could keep going, but if I want to just respect if anybody's like, huh, like if they want to drop in the chat, maybe.
yes, please do. Drop your questions in the chat. There's also the Q&A function.
Mm-hmm.
And then we do have some questions from our advisory council. So whenever you
Okay.
want, but I'll let you continue your conversation. This is very interesting.
Okay, no
Oh,
problem.
so Taisha was asking for the acronym, and I was just about to drop that in the chat. So
Oh,
I will drop the
beautiful.
brain in the chat.
Yeah, so BRAIN, benefits, risks, alternatives, intuition, doing nothing or needing more time. Okay. So as we go from mindfulness and communication, I also want you to think of nutrition, right? How are you not only pouring into yourself with food and water, but spiritually, energetically, right? We know this is a time of transition. You may have been here before, but every journey is so different, right? So we talk about food. Yeah, we want you guys to eat well, right? Think about good quality protein, high fats, avocado, coconut oil, coconut water. I love coconut water for electrolytes throughout pregnancy, and postpartum when you're lactating. It's a great tool to have in regards to labor, depending on if you choose IV fluids or not. It's a great way to stay hydrated and get you replenished with electrolytes. Calcium-rich foods are great, as well as, of course, continuing your prenatal through pregnancy and the postpartum period. Some people might already be active. So remember, if you are used to lifting weights, running, jogging, those type of things, it is safe to continue throughout your pregnancy because your body is already used to it. And from a mental health standpoint, that might be your outlet. That might be really, really important for you to keep doing, through your pregnancy and once you get the okay postpartum from your doctor to continue. So don't be afraid of like, oh my gosh, I'm running, I'm gonna hurt my baby. I think movement, gentle movement in the body gets the blood flowing, it loosens up the muscles, the round, your ligaments, round tissue, which also gives more space for the baby in regards to as they get bigger, descending, and the labor as well. So we talked a little bit about, everything being a choice. Here is just a visual of some common, I don't want to say interventions, but monitoring and tests that might happen and be offered to you throughout different stages in your pregnancy. The reality is, and I could talk from a personal experience of a very hospitalized birth the first time, and second, choosing a home birth. If you are a low risk person, and in America, they say over 35 is geriatric age. That is not necessarily true, although they title us as that. Remember, you are an individual, right? And so I think it's really important to say, hey, my blood pressure is good and my diabetes is good. Can I decline X, Y, and Z if you don't want it? So these are just some common things throughout. So 28 weeks brings you right before your third trimester. And at that point, you're visiting the doctor or your midwife every month, once a month, every 3 to 4 weeks. And it's very common for them to maybe offer a pelvic exam. It's not needed. I do find more and more these days that they are not, some providers may wait until later to offer cervical exams and pelvic exams. Ultrasounds are common at 1 and at the beginning to confirm pregnancy, and at 20 weeks for the anatomy and physiology scan, which lets us confirm the sex of the baby. We count 10 fingers, we count 10 toes. A lot of people are excited about that. However, after that, you don't necessarily need more unless high risk. And it's also totally okay to be like, hey, I don't want an ultrasound. I'm low risk and I don't want that. The Doppler and the fetoscope is just a way to monitor baby's heart rate. Whether a midwife or an OB, they will be using that to just track that baby's heart rate is in normal range. Your vitals are always taken, blood pressure, weight, height, the abdominal measurement, which is basically them taking a tape measure around your belly and measuring your fundus to see how you're averaging in regards to weeks gestation. Urine samples, you have your chromosomal testing, glucose tests for diabetes, and in very rare cases, if high risk, they may refer you to an amniocentesis, which rules out chromosomal abnormalities, placental tissue samples, and if GD, that does deem you high risk, and they might talk to you about some more nutritional ways to manage that, as well as insulin, and then the conversation of the induction might also come up. If for whatever you are high risk, different things may put you at high risk. I definitely talk to providers about how will that impact labor? How will that impact when you go into birth, if you go into birth on your own with your body, or them inducing labor, which is them, taking a certain drug, usually like Cervidil or Pitocin, to help stimulate contractions, dilate your cervix, and help labor to progress. Around 28 to 36 weeks, you're seeing your doctor or your midwife about twice a month, right? And oftentimes vitals are being taken. You have kind of done most of the basic testing already. They might suggest an ultrasound to rule out how big baby is. You might hear that a lot where people are like, my baby was so big, the doctor said I couldn't birth vaginally. You might look at yourself saying, I'm only 5 foot, 120 pounds. Oh my gosh, can my baby fit? I want you to know ultrasounds are often off by a pound or two. And also at this stage, they're looking at preeclampsia, which is high blood pressure. And they do that by checking the protein in your urine. And that usually will also determine how labor progresses and unfolds. As we're talking about the size of the baby, I actually like to use teaching tools. I have a baby doll here, which is definitely bigger than your average newborn, right? But I love this doll because I use it a lot for teachings and my childbirth and my prenatal lactation classes. But I'm going to play around with some positions with baby right now. So some of you guys, baby might be head down already, right? And oftentimes this is the position we want baby in. And I always encourage, there's something called spinning babies. I'm going to encourage you guys to write that name down. Spinning babies. It is a website. There's something called belly mapping, which really allows us to feel our baby and say, hey, I think my baby is to the left. Hey, I think my baby turned around a little bit to the right. Some providers will say, hey, I need an ultrasound to tell you what position your baby is in. We find that a lot of skilled providers can actually just feel the stomach. We call palpating the stomach and say, hey, where do you feel those kicks? Where we feel kicks are usually harder motions in the uterus, and that's where the feet are. And when we usually feel little fingers is where we know the hands are. And so a lot of times, if baby is to the left, we often feel the kicks underneath our ribs, right? And we feel those hands down by the pelvis, right? And so babies are often tucked in, that head, that chin to the chest, because that's a really important position for baby to kind of slide under the pelvic bone. And this position with baby's head to the back of us is called posterior, but a lot of times we want baby anterior because it just is a little easier for them to come out and underneath the pelvis bone. So as once again, thinking about baby's position, reach, delivery, posterior, definitely always asking those questions about what your options are, as well as seeing if you could even go to your doctor or your midwife and be like, hey, I think baby changed position today. What does that mean for labor and the positions I could go into? And oftentimes the position your doula or your midwife or OB suggests is according to the position of the baby and what helps baby to get out the easiest, or to ideally help you cope with those waves a little bit easier.
So question, Simone, when you talk about ultrasounds, I know I'm giving my age, but back in the early 90s, there were concerns about doing too many ultrasounds. But if I understand correctly, recent science shows that there's no um, result to the baby's growth and development if you have multiple ultrasounds during the pregnancy. In what instances would mama say, I've already had one ultrasound, we've counted 10 toes, I don't want another one? Is it more around her angst in having an ultrasound, or is there something I'm not aware of?
Yeah, no, I think everyone is different, right? Like I could speak from personal experience where I was just like, it's one less thing I have to run to a clinic to do, or the doctor's office to do. I'm low risk, I'm healthy, my baby's healthy. I could really kind of communicate to my doctor and my midwife what's going on. Some people are anxious where they want more ultrasounds because it feels like, hey, I could see what's going on in there. I know my baby's good, they're developing well. Nothing has changed in regards to their position. And for some, it might make them more anxious to do it. So I definitely say it is a level of like the concerns with like the radiation and certain things coming from the sonogram. But like I said, also, once we get that confirmation of the sex, which now they could do with blood work at about 10 to 12 weeks. I don't think yeah, 10 to 12 weeks. I think about a decade or so ago, they couldn't do that. But a lot of people are finding the sex now as early as 10 to 12 weeks. We used to have to wait for the anatomy and physiology scan at 20 to 22 weeks to get the sex. And then once you know 10 toes, 10 fingers, it's up to you if you might be like, I'm good. I know my baby's healthy.
Okay. So really it's probably more individualized. Like if you're
Definitely.
carrying multiples, for example, they will likely
It will,
do,
so then you would be
yeah,
considered high
more.
risk. Yeah,
Yeah.
you would be considered high risk. It's going to be important, baby A versus baby B, what position they are in. Especially there's a handful of providers that may even be okay with delivering twins vaginally. So that information is really important to know how to move forward with the labor.
Yeah, good.
Another thing with parents with gestational diabetes, babies tend to be a little bit bigger, right? So you want to maybe manage the baby's weight a little bit more and see how baby's measuring, even though it's not 100% accurate. It will at least put on the doctor's radar what's going on with baby.
Good, thank you. Now, I wanted to make sure I also captured the two resources that you mentioned. One was spinning babies, and what was the other?
So within spinning babies, you can find a technique called baby mapping. And it kind of just explains to you how you can feel your baby, the way I was just showing the different positions of baby, and kind of say, hey, under my rib are these kicks. Oh, I think baby rotated to the right today. So I find really a nice way to empower parents is for them to be able to tune into their own body and kind of guess for themselves what's happening inside of them. I know some people, the first way they even know they're pregnant are the changes in their body, right? My breasts are swollen. I'm nauseous every morning. There's so many ways that you can be like, oh, something's a little off. So I really encourage parents throughout the whole process to really check in with themselves daily, how they're feeling physically, mentally, what baby is doing. That gives insight into our well-beings, but also I think it empowers our parents to be like, no, I'm good. And to be able to even go to the doctor and say, hey, I think my baby changed position today, or this is going on, I think is nice for some people.
Oh, I think I found the link for that. I
Yes.
dropped it in the chat.
No, I talk about that a lot. I think that was as a doula, that was a game changer for me in regards to education, because it also helps with labor and knowing what to encourage with positions as well. And by the time you are 36 to 40 weeks, you may be presented with the option to do a cervical check. A cervical check is when your provider checks how dilated your cervix is. A membrane suite is when your provider may want to stir the pot, we say in the doula world, a little bit, and manually just sweep your membrane, your cervix, to loosen things up and help labor get going. And if you are high risk, they probably are doing a stress test a little bit more frequently, monitoring you a bit more. A question to ask is how far over your due date will your provider be comfortable with you going? And that is oftentimes also when I see them doing more stress tests. But once again, cervical checks are not a must. You can definitely say, hey, that's uncomfortable for me. I don't like that. I also want to honor people's individual stories. If there's anyone out there who is just, there's trauma sometimes that happen to us, and we may not want those things to happen to us from our providers or in the labor room. That's something to bring up in your birth plan. And the body's so smart, right? When you are close to 10 centimeters, your body kind of does its own thing in regards to pushing. It's called the fetal ejection. Where your body is just trying to get this baby out. If you choose to have an epidural, it's a little bit different, but I think from a doula's perspective, we are looking at you vomiting, having diarrhea, going through hot flashes, just certain things that, once again, your body is always communicating to you what's going on. And we're looking for that sign that helps us to also know the progress of labor.
Can we talk a little bit about the membrane sweep, Simone? I know there's some there's some docs who still do it as a standard practice, but now
Okay.
correct me if I'm wrong. The first part that we want to confirm is that it should not be recommended or unless there are extenuating circumstances, and then I would still argue that there are other ways to induce labor. But um, the prevailing opinion, right, is that you don't do a membrane sweep until mama is at least 39 weeks, right?
So it's funny
Right.
because when I started my career 10 years ago, 37 weeks was considered full term, but now it's 39. We know there's such a big change in brain development just in those 2 weeks. So the more you could be closer to 40, the better. But there is really no reason for a membrane sweep to be standardized. At 39 weeks, also, we just from the concept of like your body does what it knows to do, stirring the pot with a membrane sweep could actually like make you quite uncomfortable.
Mhm.
Contractions and spotting can start, but it doesn't mean labor will start. I'm a strong believer in like when your body's ready, it will be ready. Not to say you can't do things to support labor, right? We might encourage someone who's high risk, or we know the doctor might suggest a medical induction or even go on vacation, right? We don't want that to be a reason for an induction of labor, right? The golf tournament or vacation. But that's when we might say, hey, go to a chiropractor, go to an acupuncturist, um, have sex, nipple stimulation that plays into the hormones that our body releases when we're making love. That also helps dilation and relaxation happen. So the membrane suite, I often do see it. It might be mentioned, at 38, 39 weeks, but it definitely does not have to happen. And if you do choose for that, you might spot labor can start. You might spot and it's just cramping for a few hours and then it stops. And some people go on to have a second one once they get to 40 weeks or so, depending on what's happening with them.
Okay, thank you.
Yes. We talked a little bit about diet already and nutrition. So these are just all food ideas. Once again, through pregnancy and postpartum, you want to bulk up on the calories. I always say like, they're like eat for two people. I really ironically don't think you're truly eating for two people until you're in the postpartum and breastfeeding. That's a whole different beast in regards to lactation and the calorie intake. This kind of gives you a visual of baby in regards to being in your tummy. I love visuals. I'm a visual learner. So going back to belly mapping, this really gives an idea of like our placenta, the baby being attached by the umbilical cord. Are they facing forward? Are they facing back? As we get bigger, our ligaments stretching, the discomfort that might happen. A lot of times the chiropractor, massage therapist, yoga also helps with all of that as baby is getting bigger as well. So I'm going to encourage you guys. I am going over a little bit of, labor prep, just because the mindfulness, once again, we're trying to integrate that throughout, and we'll be mindful of time, but I still encourage you guys to all take a very thorough, in-depth childbirth ed class on your own, where you could be practicing comfort techniques. You can get more individualized questions answered for yourself, as well as things tailored for you and your partner's experience right now. I think a lot of times, I think I mentioned a lot of people go, oh my gosh, my water broke. I need to run to the hospital. There's stages of labor, and we also want to honor, you could feel contractions for hours before, it's time to go to the hospital, even a day or two. The truth is that we have something called Braxton Hicks all throughout our pregnancy. Braxton Hicks is when the uterus is constantly contracting, right, as practice, and you tend to feel it more and more as baby gets bigger, because you're running out of room, and so it gets quite uncomfortable. So we have contractions, so just terminology that might be helpful, and you might even be like, oh yeah, I felt that. Our contractions also used as surges. The word surges or waves is something that is used for it. Think about your birth plan. Some people I think waves are a beautiful vision of it, because literally contractions without Pitocin and certain interventions really feel like a rising, a peak, and a coming down. I find that with clients, sometimes just the visionary, when we talk about mindfulness, envisioning those waves as they come on, you're going to get to a peak. There's going to be a tightening of your uterus at that peak, and it's going to come back down. Really helps them, I say, to ride the wave through labor. Right. Some people also use it as surges. And this just, I think sometimes our language around birth and labor, if it's changed, it could really change the way we look at it. Part of your birth plan could even be, hey, don't use the word pain for me. It's very common in a hospital setting that maybe the nurse comes in and say, hey, on a scale from 1 to 10, what's your pain level? It's discomfort. I don't want to say it's like, walking through lilies and, sunflower fields, but the discomfort, knowing like how to cope with that. How do you cope with your period, right, cramps? When you have a tummy ache, what do you do? Tapping into those techniques can be really helpful as you go through those surges and those waves. Effacement is basically how thin the cervix gets. So when someone does get a cervical exam, they're looking at the effacement, the dilation, which is how open the cervix is. It could go from a penny to the size of, I believe, like a bagel or a donut, which is a nice visual from like 0 to 10 centimeters. Bloody show, it's something that when your cervix starts to dilate, some mucus, some blood starts to come out. Oftentimes as a doula, we say maybe put on a panty liner, put on a pad. If your water breaks, you're definitely putting on a pad, but this is all times to still be very calm. I'm going to have another acronym for you guys to remember. It's called COAT. If your water breaks, right, you want to remember the color. Ideally, it's clear. If it is not clear, that is a reason to contact your care provider. Is there an odor? Hopefully, no odor. What's the amount? Is it trickling? Is it gushing? Everyone's water breaks and it looks very different for everybody. So once again, put that pad on. Are you soaking through a pad in an hour? Are you just, is it just trickling out? And the time, how long has it been since your water broke? For some providers, they might tell you to come in right away to be monitored, especially if there's any color or odor to it. But also, your water breaking is not a reason to run to the hospital. You can call them and let them know, but a lot of times if your water breaks first, there's much more time before that baby comes, especially if it's your first baby.
I think
And
it's a
last,
good place to ask a question that we see a lot, Simone, and that is about the use of Pitocin. You had mentioned that the contractions feel more like waves if mama hasn't had Pitocin. Can we
yeah.
talk a little bit about, what are some of the concerns with using Pitocin, and what changes when you use Pitocin?
Yes. And so I really want to honor that everyone's journey, once again, everyone's journey is different. And we know, I think what's important about childbirth ed is we want to honor those who choose an epidural, who need Pitocin, who need interventions, right? But when are the optimal times to get these things? Being mindful of the choices around it. So your natural contractions with your oxytocin. Oxytocin is what your body releases. Pitocin is man-made oxytocin, right? And it's what helps to contract the uterus. I gave this vision of a wave peaking and coming back down. From what I've heard from clients is Pitocin makes it feel like a spike as opposed to a wave, right? So Your uterus is always already doing hard work in labor, and the Pitocin kind of adds to that. So sometimes it over contracts, and that's one of the concerns in regards to having Pitocin if not monitored well. And how will you and baby respond to it? So if there's a need for Pitocin, and Pitocin is often used to start labor or to augment labor, and augmentation may be like, hey, I've been in labor for a day now. I'm really tired and my contractions have slowed down because my uterus is so overworked. And so they might suggest Pitocin as a way to get those contractions started again. We always want to be mindful of how high they're putting the Pitocin on. Pitocin can always be lowered or turned off to give your body a break. And what is the baby's heart rate while the Pitocin is on? As a doula, we're always monitoring and looking at that fetal monitor to make sure the average, if a contraction and the baby's heart rate goes below 120, we're kind of like, okay, maybe change positions, right? If it goes anywhere in the hundreds or lower, we're definitely concerned. And so we're looking at if it goes too low or too high. And I think the advocacy around having a doula, having someone in the room that could kind of navigate those things, I'm biased, of course, right? Is because we parents, we don't want you navigating all of that. We don't want you kind of, is baby okay? I don't know what's going on, all of those things. You could have your family as support, your mom, an aunt, a sister, your partner, and the doula is additional. Definitely during COVID, a lot of things have changed. So I also encourage you to ask your provider as well as the hospital, what are their rules and regulations about doula support?
Thank you for that.
Yes.
So then my brain is not entirely linear,
No,
but
no,
I'd
no.
like to go back to something else that you said about IVs. So if I am not taking medication, i.e. Pitocin, and I
Mm-hmm.
come to the hospital and I'm in active labor, so I really don't need Pitocin, right?
Mm-hmm.
Um, I don't, that is one of those times where I can say, I'm not ready, I don't need an IV, right? Because
Absolutely.
you're not
Absolutely.
giving me medication.
Yes, yes. In the ideal world, we would want everybody to walk into the hospital at 5 to 6 centimeters or more, right? That doesn't necessarily happen for many reasons. And I think still being involved in your decisions, despite how early you go into the hospital, is really important. So if you're coming in and they're not necessarily pushing an epidural or Pitocin or a cervical ripener, you can get something called a hep lock. A hep lock is it goes either this is not very comfortable, but your hand, your wrist, the in between your arms, where your elbow is like probably the best place to put it in regards to accessibility. Your veins are biggest here. However, when it comes to like bending your arm, holding the baby, could get a little bit in the way during postpartum. That makes sure that your vein is accessible in case of an emergency, but you're not hooked up to the IV, because the IV comes with a pole, and wherever you go, you're like dragging it around. So as long as you ask for a hep lock, that makes it known that, hey, I don't want any IV now, but if needed, I will choose to have it. But even despite IV, I'm all about your Gatorade, your coconut water, your Labor-Aid. Labor-Aid is basically something that you can make with honey, lime water, magnesium. You could add some cherries in there to make it fun and flavorful. Those are things that help boost your electrolytes as well as keep you well hydrated through your birth and labor.
A wealth of information. I have never heard of a honey
Oh yes,
braid.
it's quite fun to make too.
And you're gonna have to share the recipe with us. Like, what are the like how much, how much, or is it just a taste?
It's to taste, because I have made some where I'm like, oh, I need to add more lime. I need to add more honey. Also, the fruit that you use is different. I've done lime water, I've done cherries, I've done lemon, but they're quite fun. Okay, so we've gone over some definitions of things to think about with contractions, bloody show, effacement, certain things that are looked for by your provider as labor starts. Now, these here on the screen, you will see the stages of labor. And so the early first stage of labor is the longest stage, as well as Not as intense as it could be in the later stage of labor, active stage, right? This can last weeks, days, or hours. We go back to those Braxton Hicks and constantly practicing. The uterus is constantly contracting. This could be, hey, 10 seconds, and then 3 hours, 4 hours, 5 hours later, there's another 10 seconds. It's very rarely maybe stopping you in your tracks. You can feel them, but you're able to move around, maybe hydrate. A lot of times if Braxton Hicks, like if you drink water, and they go away, we know that you're not in labor yet. Your body is just practicing. Once you start to hydrate and change positions and do everything, and then the contractions continue to come, that's how you know labor has started. So this first sign of labor is not the water breaking. The first sign of labor is that pattern in the contractions. There is something called Full Term, an app called Full Term that you can download on your phone in regards to timing contractions. I love to write things out. So everyone's different with apps and writing, but that's a great app to just say start, finish, and time your contractions and get a pattern of what it's doing. This is also a time where you rest. We don't know how long labor is going to be. You eat, you rest, you keep moving. And this is also about 0 centimeters to maybe 4 centimeters or so. By the time we are moving into mid-stage active labor, now you're more into your 5 to 6 centimeters. Contractions are closer together, right? So as we move from early labor to active labor, you go from maybe 20-second contractions to maybe 45 to a minute contractions. And now they're coming more consistently. That could be every 10 minutes, every 5 minutes. This is also something to consider and talk to your provider in regards to when do you go to the birthing center? When do you go to the hospital? Most birthing centers will admit you once you are in active labor. Most hospitals, they may turn you away if you're in early labor, but if you do want an epidural, they will keep you. And so think about that in regards to your comfort level, what your birth plan consists of, and are you close enough to the hospital to turn around and go home, or you got to set up camp once you're there. Now, once you are in active labor, like I said, your waves are coming more consistently. This is where you might have to tap into some comfort techniques, right? Maybe you and your partner have spoken about those massages, those shoulder massages. Maybe you hold tension there, those foot massages that help to relax you. Maybe you've brought some lavender oil, right? Going back to that mindfulness and that calming technique, right? So that all carries you through your labor. I love lavender oil. I love for calming, peppermint oil or a citrus for like a boost of energy. Um, there's something about frankincense and myrrh that's just a little earthy and grounding. Some people know for sure that they have problems like holding tension, they clench in their jaw. Maybe your partner or your doula is just massaging those cheek muscles, right? There's something called horse lips that is just basically and you see how when you do that, just like everything just relaxes, you drop your shoulders, right? So some people do that a lot through labor. You might have a birth ball that you're encouraged to sit on, a peanut ball if you're in bed. So we just want you to be comfortable and still tap into those things that comfort you throughout labor, even though things might be revving up some.
Quick question, Simone. What's your thought on a water birth?
I'm biased, right? Because I'm like, I did have a home birth with my second. I didn't make it into the tub. With a water birth, if you are high risk, they're not letting you birth in the tub. However, water births are beautiful in regards to babies coming out of water, going into water, and they don't take their first breath until they're out of that water and their lungs hit the air. Once the lungs hit the air, everything opens up and now they're breathing oxygen. So, whether it's a water birth or you're using, we call it hydrotherapy. So that's a bath at home in early labor, using the shower in early labor throughout all of labor, actually pushing in a birthing tub. I think that's a great option for relaxation as well as coping through labor. From a facility standpoint, at home, of course, you could do whatever you want. Birthing center, water births are very common. And hospitals, some hospitals will have birthing tubs and they'll let you labor there. But once you need to push, they'll have you come out and go onto the bed to push just for being able to see and, access certain things. But skilled providers should be able to support you in you birthing your baby in whatever position, despite where you are.
Thank you. Jasmine says she's had a water birth and it was beautiful. I've seen photographs and it does look so truly magical. And the mamas look like they're so not enjoying, but it looks like what the Madonna moment that we all tend to have
Yeah.
about birth, right? And
No, it's like I do think it adds a level of zen for some people for sure. Like I said, I had a tub sitting in my living room, never made it into it, but but I was in the shower for about a good hour and a half when contractions started with my second.
I would think that would help with some of the, the stress and tension. Speaking of stress and tension, I see that our clock is ticking, and one of the questions
Yes,
that came in was around, um, things that the partner can do, because
absolutely.
we often, yes, the mother is doing the bulk of the of the labor for real. Um, but the partner, what can they do to relieve tension or stress so that they can stay present
Yeah.
in their support? I would, of course, caveat that with having a doula will help, because then the partner is not put in the role of like defender of all things. And
Yes.
but what are some other things?
No, the doula I think is a great addition to the birth team. I always say we don't know how long labor is going to be, so they could tag team if needed. Someone could go out and get some tea or water while the other one is supporting mom in labor. So for the partners, in regards to supporting the pregnant person, that's massage, hands-on touch. A lot of in-person or virtual childbirth ed will go over a comfort measure section of the class so you guys could practice certain things. I do think it's great to just learn what pressure to put on mom, right? What level of squeezing and touching and holding they like, what really calms them, what part of their area do they hold more tension. I think for partners, the education prenatally really lets them understand this is normal. Right. And I do find them to kind of be a sounding board when the laboring person is kind of like, oh my gosh, right? They're like, hey, we got this. This is okay. This was a part of what we spoke about. But when it comes to if they do need to step out, if you are fortunate enough to have another family member, I do think knowing how to tag team is really important. Sometimes water I think is powerful, not only for the birthing parent in regards to shower and bath, but there's still like something beautiful about just running your hands under water and
Mm.
grounding yourself, or just splashing water on your face and just coming back down and then going back out and supporting that birthing person. So I think those are all really important. Even when you think about your soundtrack through labor, if you create a playlist, slow dancing together, right, is really beautiful. Brings you back into your body. It's an intimate time. I've had some crazy playlists. Play in labor delivery rooms that were really like salt and pepper, TLC, Motown, so music, meditation music, raindrops. There's so many sounds that could play in the background to help ground both people in labor. That's very helpful.
I love that. And I think music helps to drown out whatever else is going on
Yeah.
in the hospital setting, in terms of you hear the beeps and all that. I think someone has a wonderful question. How close is mindful birthing to hypnobirthing, in your opinion?
I think it's very, very similar in regards to, like I said earlier, mind over matter. Hypnobirthing has very specific mantras and soundtracks that you can incorporate into your labor. However, I think that is possible with any birth, right? I've had clients, we add index cards throughout the labor room with affirmations. So maybe every time you look, there's a different affirmation and you're just repeating that in your head. So I find like hypnobirthing has a soundtrack. It definitely helps you to learn how to get into your body, right? There are classes very specific to touch and how you feel touch and what your mind does when you get into certain spaces. And I think sometimes, I mean, control over your mind can be so difficult when you are in a very high intense environment, which the hospital can be at times. So I think there should be mindfulness in all types of birth, cesarean birth, vaginal birth, inductions, spontaneous labor. However, hypnobirthing specifically has like mantras and tracks that are attached to it.
So if I understand correctly, from what, and I just dropped one of from our website, um, just my limited exposure from brilliant birth workers like yourself, that hypnobirthing truly is a matter of self-hypnosis, right?
Yeah,
Or your,
exactly. Yes. Yep. Yep. A lot of times the providers that teach the class may be hypnotherapists too. They don't have to be, but they definitely learn techniques to do it. Um, Hypnobirthing is a great technique. There's something called havening, which I've done before on my clients, and it's just continuous strokes on your body in certain areas, and they create delta waves. And delta waves is something that our body releases when we're drifting into like a sleep state. And there's just something so calming about a certain level of pressure on us, whether it's on our legs, our back, our shoulder to our wrist. There's just something about touch that's really calming. So when I think about touch and meditation, I think about what we can do audio, right? A lot of times it's like, what can we do with all our senses? What could be playing in the background? What can we be doing tactile? An essential oil for smelling. Maybe you have an eye mask on to block out the lights and just like overstimulation in the labor room. So oftentimes when it comes to comfort measures, we're talking about all senses being touched.
Ooh.
Yeah, so I
We're
think
gonna
that's
have to have you give us a list of what we're packing in our bag because I had never thought about the mask and because the start lights and even when you turn the lights down, the nurse or the care team will come in and flip them back on. And so if
yes,
mom
yes,
do that, yeah. And then we heard medicine ball, right?
yeah.
We're packing that. Um, anything else that we um in our last few minutes, we could have
No,
every
this is the ongoing
you
conversation.
know,
It's like baby
we're
is not
gonna have to do a
here
workshop, guys,
yet.
on what to pack, and we need a workshop because I had never heard of havening. And we have this wonderful friend who is a somatic healer that does all the touch and that dynamic. I think she and
Mhm.
Simone need to come back and just take us through that. She's the one that's keeping me grounded right now. So when I'm like, and so there's so many techniques to this with the havening I'd not heard of. We may have to do a workshop solely on that conversation because the other piece of it is when postpartum. Let's talk about in the last few minutes how we can take these techniques to our parenting journey.
Yeah, no, I was like, I know we can't like get through everything, but I think when it comes to mindfulness, now, if you have a history of depression and anxiety, you're already at risk of that possibly showing up in your postpartum period. We know in the first 2 to 3 weeks, baby blues is very common, and that is like, oh my gosh, I'm crying at every commercial. We're on an adrenaline high because you just gave birth, and so it kind of feels hard to be in your body. But at 3 weeks or so, 2 to 3 weeks, I also see that's when people are kind of like, hey, I have a baby. Now what? I think it's important to know, talk beforehand about possible expectations with your family, with your partner. I always say you guys know each other as partners, but you guys do not know each other as like now mom and dad or parents and so forth. And so that's a different dynamic. You're not only learning a baby, you're now learning each other in a different way. And so give yourself permission to, and it's hard. It is very hard to either say, hey, I need to go take a shower and just, you know, get 15, 20 minutes to just take a shower. And I think as a nursing parent, that clock, you're like trying to brush your teeth, eat, and shower all but like in between each nursing session. Lactation, that's a whole different conversation. However, when you are able to get help, definitely try your best to have people delegate tasks, right? On your fridge, maybe you're saying grandma comes over every week and makes a pot of stew for dinner, and does some freezer meals.
Mhm.
Maybe my sister comes over and does laundry while I take a shower every day. I remember one parent, every morning I would arrive, she would do her face routine, do her hair, like it was important to her. So think about what self-care looks like for you now and how you can still implement it. In the postpartum period, I'm an advocate for baby wearing because even when baby's fussy and going through growth spurts and cluster feeding, you could have your baby on you while your hands are still free and you're still able to drink your tea or your coffee and eat, go for a walk if you want to go out. Vitamin D and sunlight are very important and fresh air in those beginning days. So yes, you just had a baby. We don't want you walking miles and miles. We often say, in bed for a few days, around the bed for a few days, and then starting to venture out. So honoring the healing and what your body is telling you to do and asking for support, I think is really, really helpful when a lot of times we sometimes don't know what type of support we need.
Oh, that's so true. Thank you, Simone. This has been a wonderful conversation. I always learn so much from you, and I hope our audience has as well. I'm sorry that we can't do this for 2 hours, but I bet some folk are on lunch hour. We'll bring you
Yeah.
back. I promise, guys, we'll bring you back. I did drop in the chat. Um, Simone's website so that you can connect with her, follow her on social media to continue this conversation. We'll most certainly have her back. Next month, we're to continue this dialogue around planning our labor and parenting experience. We have a wonderful doc that has worked with us, and he made a compelling comment in one of his workshops where he said, when we plan our wedding, for many of us, we plan it down to the napkins, the little matchbooks, the little champagne, and all the accoutrement, right? But when it comes to our pregnancy and delivering our baby, we don't
Yeah.
so much. So we're so excited to partner with brilliant people like Simone to give you the tools to plan for a mindful birth. Next month on February 28th, you'll have to join us for a conversation around the importance of birth planning. And we're going to have two amazing birth workers who are going to share with us. You can see that on our website. We're also pleased to partner with the Healthy Birth Day group that started the Count the Kicks initiative. Simone touched on it a little bit about learning your baby and their movements and understanding how they're positioned. Christine Tucker from Healthy Birth Day will be with us on the 28th as well in the evening to talk about what is the Count the Kicks initiative, how it's important, and then the clinical results they've seen from just mamas being educated around this benchmark with their infants. So do pop over to our social media. We're on Instagram and Facebook, as well as LinkedIn, and we'll have information about these workshops. Thank you again, Simone. Thank you, thank you, thank you. So appreciate it. And we hope to be with you again soon to talk some more about these wonderful things. This recording will be on our website by no later than tomorrow on our YouTube channel. So you'll have a chance to go back and pull some of the notes. There were so many kernels.
Thank you, Marie, for having me. You know, I'm always happy to join.
Oh, same here. I'm a fangirl. But you guys have a great, great afternoon, and we'll be with you soon.